All right, today we will be starting vital signs assessment, which is chapter 16 in the class textbook. Vital signs, as I've mentioned, super important for you to understand the different components to them and what they mean, because you will then use this whenever you're making your medical diagnosis. All right, so what are vital signs? So they are used to assess the different conditions of the different body systems within your body. So your vital signs typically are going to assess the state of your respiratory system and the state of your circulatory system. How are those functioning? If you don't already know, you will not be alive if your respiratory system is not functioning and your circulatory system is not functioning. So these are just super important if there are any abnormalities to pay attention to. And then these vital signs are going to change as your body reacts to an injury or an illness. So example, if you are somebody who is suffering from severe bleeding, hemorrhage, oftentimes blood pressure, which is a vital sign that we'll talk about today, tends to drop, and that's just because you're losing blood volume. Opposite of that, if you have even, let's say, nothing super serious, but maybe you've worked out, you've overexerted yourself, vital signs like your pulse, which is indicating your heart rate, that might increase. So again, they're going to change kind of how your body is reacting to its environment. The major vital signs that we will be going over will be pulse, blood pressure. So we're going to cover pulse and blood pressure today. And then we'll focus on respiration, temperature, and pain in the next set of notes. All right, so what is pulse? Pulse is a way that you are able to figure out the status of your circulatory system and cardiac function. So just know that you guys will be doing a pulse lab on Monday. Pulse can only be felt in your artery. So just know you have different types of blood vessels throughout your body. You have major ones called arteries and major ones called veins. You cannot feel your pulse in a vein. You can only feel it in an artery. So I'll be going over that more so on Monday, but just keep that in mind. And your change in pulse can indicate a change in the patient's status. So we'll talk about what is a normal range of pulse and what it means when there maybe has an increase in a pulse rate or decrease. And then just know too that if there is an absence of a pulse, that's going to indicate that the person is either going into cardiac arrest or they're dead. So when we cover CPR next semester, and when we hopefully can get on more hands-on stuff, you will have to know that you should be checking someone's pulse, checking their respirations prior to performing CPR so that you can determine if that is an appropriate treatment. So when you are checking for pulse, you always want to make sure that you are using your index finger and your middle finger. You do not want to use your thumb when you're determining pulse, because your thumb actually has its own heart rate. So you might, check someone's radial pulse, which is what this person is feeling for. And let's say you're using your thumb, you're going to be like, oh, okay, this person's heart rate is this. And then it's actually your heart rate. So you're always wanting to use your index finger and your middle finger to check for pulse. And then you will need to know this range. So normal pulse for a healthy adult is going to be 60 to 100 beats per minute. Children and smaller animals tend to actually have higher pulse rates, and that's just because their heart is going to have to pump harder for it to be more effective. But just know that tachycardia, that's the medical term for a higher than normal pulse rate. So anything that's going to be above 100 is considered tachycardic. So it's very common if you just recently exercised, let's say you did, some jumping jacks, and your heart rate's higher than 100. It might be like 120, 130. That's normal. When your heart rate, though, is like in the 200s, then that's when you might have some cause for concern. You also have what is called bradycardia. So this is a pulse that's below 60. I mentioned when we went over medical terms that athletes sometimes have lower resting heart rates. And so they could have a pulse between 50 and 60. And for them, that is normal. They're not suffering from, lightheadedness, things like that typically you might see with someone who has bradycardia, and they're maybe suffering from an actual medical condition. It's just that their heart's able to produce blood and circulate it throughout the body more efficiently. Your pulse, and you will need to know this for your lab on Monday, can be described as regular or irregular. So what that means is, does it have a normal rhythm? Does it sound like, or is it like, like all over the place, that would be an irregular pulse rate. Quality is referring to the actual strength of the pulse. So is this pulse weak? So can you hardly feel for it? Does it feel very strong? You can have what is called a thready pulse. So this might be that it's really hard to feel, but when you do feel it, it's very rapid. And then you can also have what is called a bounding pulse. So this is a typical type of pulse you might feel if you've just done something really strenuous. Maybe you've had an anxiety attack. It feels like your pulse is going to like burst through your skin. It's a very strong pulse. And then it can be felt in various places throughout your body. So just again, remember you can only feel them in your arteries, but the most common sites that you're going to be able to feel your pulse is in your radial and carotid region. So radial pulse is on the inside of your wrist and it's underneath your thumb. And so there's an image if we go back to it. So this is radial pulse. So it's on the thumb side, inside of the wrist. If you try to feel it on the pinky side, you won't be able to feel for it because there's no artery right there. You might feel it, but it's going to be very weak versus if you move your fingers over to that thumb side, you're going to be able to feel it much better. You then also have your carotid pulse. And so this is the one that's located in your neck. So I often tell my students, feel for your actual throat, like underneath your chin. Then you're going to go just to the side of that. You should feel like a little, like a divot kind of. And you should be able to feel your pulse in there. So you're not going to be able to feel it if you're talking. You're going to have to relax your throat, but you should be able to feel your pulse in that spot. And then these are some other pulse sites. So you actually have a pulse in your forehead, which is known as your temporal pulse or temporal artery. So it's just right near your temple. So you can actually palpate that as well. You have a brachial pulse, which is located on the inside of your arm. So we will go over blood pressure, and eventually you guys will have a hands-on skill competency or assessment on blood pressure. We can't do that right now, obviously, because we're not doing hands-on. But the brachial artery is where you would palpate before you put the blood pressure cuff. You have an artery in your groin region known as the femoral artery. You can palpate pulse there. You have your popliteal artery, which is behind your knee, or popliteal. And that one also you should be able to feel on the inside of your knee. And then the last one, there's more. There's the posterior tibial, which is on the inside of the ankle. And then this last one is your dorsalis pedis artery, which is on the top of your foot. So all of this is, I know, a lot of information. Just know that we will be doing a pulse lab on Monday. So just try to keep in mind these different locations. We'll review this too on Monday, but again, you guys will have a lab coming up. All right, last thing we'll talk about today is blood pressure. So just know blood pressure is the measurement of the force of blood against the actual walls of your arteries. So how much pressure is within your artery, and it's recorded in two measurements. So if you've ever gone to, let's say, the doctor, and maybe they've hooked you up with an automatic blood pressure cuff, or maybe they've even done it where they put the stethoscope on your arm and they're listening. Either way, you're going to get two numbers. The top number is your systolic reading. So that's the amount of pressure when your heart is contracting. And then you have your diastolic reading. So that's going to be a bottom number. And that is when your heart is actually relaxing. So what pressure is going in the artery during that phase. So again, systolic average is going to be 120 for systolic reading. So if you're around 120 and your diastolic is around 80, so that bottom number, that's considered normal. So if you were to, let's say, go and get your blood pressure done or assessed, it's going to look like a number where it's 120 over 80. It might be like 119 over 76. It's going to vary. If you're close in that range, then that means that you're considered normal. Sometimes it can even be as low as like 110 over 70. Can also be considered normal. You can have, though, what is called hypotension. So hypo means a decrease, and tension is talking about blood pressure. So the medical term, and you guys will need to know this, for low blood pressure is hypotension. So someone with hypotension, they're going to have a reading that is systolic of, it's going to be 90 or less for their systolic reading, and then it's going to be 60 or less for their diastolic. So it's going to be a number that's much lower. And then hypertension is somebody who has high blood pressure. So hyper is high or increase in medical terms. And so somebody with a high blood pressure reading is going to have anything that is 140 over 90 or above. So a lot of times when people are diagnosed hypertensive, they're having readings where it's like 180 over 110, like it's really high, or like 200s even. So that's going to indicate that their heart is not functioning properly. They're not getting enough circulation. And so how you assess blood pressure is by using a sphygmomanometer. That's an extremely long word, but it's just a fancy medical way of saying a blood pressure cuff. So again, you guys will eventually learn how to use a blood pressure cuff, and I actually will be checking you guys off. We're not going to do that right now just because, again, we don't have access to this equipment. But you guys will eventually learn how to use one of these along with a stethoscope. And then you'll also have a chance to practice with an automatic one as well. And then the last thing I want to talk about is just several reasons why someone might actually have hypotension versus hypertension. So people who are dehydrated, they may have an internal injury. So like what I was talking about with maybe a hemorrhage, severe bleeding. If they're suffering from heat illness, so heat stroke, heat exhaustion, if they have a type of liver disease, maybe liver cancer, sclerosis of the liver, your liver helps to maintain fluid balance in your body. So it's going to affect your blood flow as well. And then sometimes people too who are diabetic can also have hypotension, so low blood pressure. Opposite of that is your hypertensive reasons. So people with high blood pressure, people who have heart conditions can often have hypertension. Those that are overweight can have hypertension. Those who do not exercise can have hypertension. However, just know too that if you were to exercise and then get your blood pressure read like right afterwards, your blood pressure does increase a little bit with exercise. And that's just because your body needs to make up for the fact that it's having to work a little bit harder. But again, if you don't exercise like at all, that's going to lead to potential obesity, heart problems, things like that, which can cause hypertension. Having way too much salt in your diet can cause hypertension. So a lot of people who are on blood pressure medication might be prescribed a diet that's low in sodium. And again, that kind of has to do with the fluid balance that is affected. And then lastly, stress is another huge thing when it comes to hypertension. Stress in general is terrible on your body. So oftentimes too, if somebody is on hypertension medication, they're going to prescribe them a diet that's low in sodium. They might prescribe them to exercise a little bit more, and they might also tell them try to do things that decrease your stress. So it could be maybe meditating if that's what decreases your stress. Maybe it's, stepping away from your work for a little bit to decrease your stress, or finding hobbies to do. So again, stress is terrible for your body. And I will say this throughout this whole class, but just doing things to de-stress is super important because it can lead to conditions like hypertension. Anyways, we will stop there for today. Just make sure you turn in your notes by the end of the period. And I will see you guys on Monday to go over your lab.